Hello, everyone. Welcome to our webinar. This is in the framework of partnerships that the project that called Home Migrant Hub is doing with different organizations. And today we have Michael Xerras and Raúl Hernández from City College of New York and Memorial Sloan Kettering Partnership Program that will, and they together will present updates on COVID vaccines and current COVID rates in New York and recommendations for the most vulnerable populations. And you'll be able to ask questions in Q&As or in the chat. And at the end, we'll unmute people if they want to talk. For now, you can just write your question while Raúl will start presenting, and participants will please stay, everybody, for a survey at the end of this short presentation and our discussion. All right.
Thank you so much, Tanzilia. I'm so excited to be here again. I really appreciate Her Migrant Hub. I want to thank you and thank everyone for joining us today. It's 5:05 p.m. And we're going to talk a little bit about COVID-19 vaccines. My name is Raúl Hernández. I am the Community Outreach Coordinator, Health Educator, and Research Coordinator for the City College of New York MSK Partnership. It's a partnership that really brings together the resources from two institutions, City College of New York and Memorial Sloan Kettering, to improve health outcomes for the underrepresented communities here in New York City and in New York abroad. So we primarily work in the areas of cancer and cancer disparities. So we also provide referrals to healthcare providers and health insurance. And today, because we know COVID-19 is still very much among us, we're going to talk a little bit about COVID-19 and some of its updates. Today with me is Michael Xerras. He is a third-year medical student at the CUNY School of Medicine. Michael Xerras has been working with us for the last year on a research project. And he's going to talk a little bit about his survey that you can fill at the end of the presentation today. And for your time, there will be a gift card that can be sent to you via email if you send us your email address. So Michael, please introduce the survey.
Great. Hi, everyone. I'm Michael Xerras again. Raúl mentioned that I'm a third-year medical student from the CUNY School of Medicine. So I'm here to talk about an exciting survey opportunity to share your thoughts on vaccines and health management. So it's a 15 to 20-minute survey opportunity where you'll be given a $15 Amazon gift card for your time and effort. And if you're interested, please wait until the workshop is finished, and I'll talk more about how you can participate. Thanks, everyone. I hope you enjoy the workshop.
Thanks, Michael. Okay. Okay, so welcome everybody. I just wanted to give thanks to CCNY-MSK, the Partnership for Community Outreach Research and Education Corps, the Vaccine Awareness Coalition of New York City, and Memorial Sloan Kettering for the images and the information provided here in the slides today. So we're going to talk a little bit about viruses, right? I know that we've been talking about COVID-19 for years, literally years, but it's important to remember that viruses are infectious particles that need humans like us to survive, right? So without us, there really wouldn't be a virus, right? They need a host. And so once a virus finds its host, finds its human, it can divide, it can grow, and then it can spread from one person to another through a cough, right? Through a sneeze. And these particles can spread farther and farther, especially if a person is not wearing masks, right? We know that mask is one of the best ways to prevent people from getting and spreading COVID-19. And so we are still reminding folks that is one of the best ways to prevent the spread of COVID-19, right? So when we think about public health, we think about, the basic tenets, right? Hand hygiene, right? Washing your hands, using a mask, right? And getting vaccinated. And we'll talk a little bit about the vaccination part in a little bit. But how does the immune system work, right? So we know that the immune system is the body's natural defense against foreign particles, foreign germs. We know that the immune system cells, what they do is they find infections, they find viruses, they find bacteria in the body and then eliminate them. Once they're done eliminating them, they create these cells called antibodies that can remember these viruses in the future and help prevent them and help fight them in the future. Okay. So I just said antibodies. That's basically a word that means that these are cells that detect and recognize foreign particles like the virus. So here on this image, for example, you see the coronavirus, right, in blue, and the antibody here that looks like a Y, or that looks like a tree, an upside down tree, right? So what happens is the first time the virus comes around, it can infect the human cell, right? And it goes inside the cell, it stores itself, it grows, and it divides within the cell. With some time, these antibodies also replicate inside your body and memorize this coronavirus, right? So that the next time that you are exposed to coronavirus, these antibodies come up, rushing out very quickly as part of your immune system response. They collect around the coronavirus and tag them. They identify them and say, hey, you need to destroy the cell. And so the phagocyte, which is one type of white blood cell, right, comes, grabs it, and digests it, right, and breaks it apart and destroys it, right? So it's it's a very neat system that our body just automatically has, right, to defend ourselves against different diseases. Okay. One way that we have learned to increase the amount of antibodies is through vaccination. So vaccination is a way to increase the amount of antibodies with having to be infected with COVID-19. I know at this point, many of us have been exposed or maybe even been infected against COVID-19, but remember that vaccinations are really, really important protectors, right? In that they increase the number of antibodies to any virus or to any sort of disease that we're thinking about. So this can apply to, for example, this can apply to human papillomavirus, the HPV vaccine, to the measles, mumps, and rubella vaccine, right? To many other types of viruses that can protect us, right? So how are these Pfizer and Moderna vaccines made? So we know that Pfizer and Moderna are under this class of vaccines called mRNA vaccines. They use very small information that is found on the spike of the COVID-19. So right here on the COVID-19, you see the corona, right? And it has these spikes coming out of it. So inside a vaccine is just information about this spike of the virus, nothing else, just the spike of the virus, right? And it's like a recipe, right, that is given to you so that your body, once it recognizes this spike information, can start immediately creating antibodies that recognize the spike protein, okay? So once that COVID-19 comes, your body already has the antibodies to detect the spike on the COVID-19, okay? And these antibodies stop the COVID from attaching to your cells and causing disease. We also have the Johnson & Johnson vaccine here in the US. And so here in the US, we have 3 vaccines, as I mentioned, right? And Johnson & Johnson is one of them, right? This is using a viral vector to deliver COVID spike information. Our body similarly creates spike protein and then develops antibodies and T cells against the spike protein so that if you encounter the virus later on, you can recognize the spike proteins on the COVID and attack it for destruction, right? However, we do know that as of May 2022, right? So this was just this past month, the Johnson & Johnson vaccine has been restricted by the FDA, right? We know that we only recommend J&J, Johnson & Johnson vaccination to those who are unwilling or unable to receive the Moderna or the Pfizer-BioNTech vaccines. We have seen, especially in women of reproductive age, right? So adult women, right? Who have developed very rare but serious blood clots, right? And so we want to make sure that everyone, but especially women of reproductive age, have options that are not Johnson & Johnson vaccinations, right? So if you have gotten a J&J vaccine in the past, you are probably okay if you haven't developed any symptoms, but we do recommend that for your future vaccinations, that you do seek out the Pfizer or the Moderna vaccine, okay? But for those who did have recently the Johnson & Johnson vaccine, we do recommend that you look for the following symptoms 3 weeks after receiving the vaccine. And that includes severe headaches, blurred vision, shortness of breath, chest pain, leg swelling, persistent abdominal pain, easy bruising or tiny blood spots under the skin that develop beyond the injection site. Right? These can all be possible signs of blood clots, right? If you have any questions, any symptoms, go to your doctor, call your doctor. Services are available by the city in case you have any questions. You can call 311 as well, okay, if you don't have a doctor. Again, these symptoms are very rare, but they are important to know about. So these again are the 3 options here in the US in terms of vaccination. We can show you that the Pfizer BioNTech are both 2 shots 21 days apart. They're currently approved for those who are 5 and older and are recommended, right? They are effective against 65% of Omicron subvariants. Similarly, Moderna is 2 shots 28 days apart between the 2 shots, and it's approved for 18 and older, and it's 44% effective against Omicron. Johnson & Johnson was 1 shot, 18 or older, and 55% effective against Omicron, which is one of the latest subvariants of COVID-19. We want to talk about vaccine testing, not just COVID-19 vaccine testing. Here in the US, there are strict testing and trials of vaccines done by the FDA. There are 4 phases. The first one recruits several hundred volunteers, where researchers try to answer questions such as, is the vaccine safe? Are there any serious side effects? How does a vaccine relate to any side effects? Is the vaccine causing an immune response? So is it basically working, right? So is the vaccine working? In the second phase, there are several hundred more volunteers where researchers try to answer the following questions. What are the most common short-term side effects of the vaccine? What is the body's immune response? Are there any signs that the vaccine is protective? So is it effective in any way? If all of that is positive, then it moves on to the third phase where 1,000 or more volunteers are recruited, where we try to compare the disease rates between people who got the vaccine and those who did not. So they're talking about blinded studies, placebo studies, where some people do get the vaccine, some people don't. They're exposed to COVID-19 and how effective it is, right? And how well it protects against COVID-19 vaccine. The next questions are really, is it safe? Is it effective? And does the benefit outweigh the risks, right? So that is a central question when it comes to vaccines. Is this benefiting us more than it is putting us at risk? And if that is true, then we move on to the 4th phase, right? The treatment is approved by the FDA and it is made available to the general public. So here we know that 1,000 more volunteers in the 3rd phase are recruited, but in COVID-19 testing, we know that 30,000 to 40,000 people were actually studied, right, for this to be moved into the 4th phase. So many thousands of people have gone through the vaccine trials. It's tested for side effects, protection against virus. We know it was given quick approval. It was funded very quickly. Many collaborators around the world worked together to fast track it and to make it available to consumers. And following approval, we know that the Food and Drug Administration tracks any side effects, and that's how we were seeing some of the blood clots associated with the Johnson & Johnson vaccine. So what groups are at highest risk of COVID infection? So we were going to talk a little bit about groups that are at high risk of COVID infection. At the beginning of the pandemic, we know that essential workers were actually most at risk, right, of COVID-19 exposure because they were out there. We didn't know the science yet. Masks weren't widely available. Vaccines weren't available. So those were the folks who were most at risk, because mostly healthcare workers and older people, right, and people with medical conditions as well. Now, we know that folks who are at highest risk of COVID infection are those who are unvaccinated. So unvaccinated people are at highest risk of COVID infection, not only infection, but severe disease, right? We know that for those who are not fully vaccinated, they are 7 times more likely to test positive for COVID-19, 49 times more likely to be hospitalized, and 30 times more likely to die of COVID-19, right? So very at risk are those who are unvaccinated. Those who are young, 18 to 29, are also most at risk. We know that this group has fewer vaccination rates and are also, you know, I don't know if you walk downtown a little bit, gone out a little bit, are you know, enjoying definitely their youth. And so, you know, they may be exposed to COVID-19 a little bit more. But still, folks with chronic conditions just take extra precaution. Folks with cancer, with immune systems that are maybe weakened, right? Those with HIV, heart conditions, chronic kidney disease, liver disease, obesity, or substance use disorders. So we still want to be careful, make sure that we're getting vaccinated and staying safe. One way to continue staying safe is by increasing the number of people who get vaccinated. So if you get vaccinated, and Michael Xerras on this call is vaccinated, and Tanzelia and I are vaccinated, and we're in the same room, right? That means that 3 out of 3 of us are vaccinated. The less likely that we are to, 1, spread the disease, 2, get seriously ill from COVID-19 vaccine. And that works on a larger scale, right? So in your building, in your apartment building, if 45 out of the 50 units in the building, people in the building are vaccinated, the less likely you are to get sick, right? And we want to get to 100% as much as possible. We know that we may not get there soon, but it is important to continue talking about it, continue getting vaccinated, and to get boosted if possible, okay? Especially for folks who are not able to get vaccinated, like young children, right? So let's talk a little bit about the vaccine side effects versus being infected with COVID-19 side effects or effects of COVID-19 infection. So when you get a COVID-19 vaccine, I'm sure most of you have felt, right, that you might feel a little bit of pain, a little bit of redness, a little bit of swelling. And in a couple of days, you might feel tired, headaches, muscle pain, chills, fever, nausea. It's usually predictable and may last only a few days. With COVID-19 infection, you may feel shortness of breath, cough, difficulty breathing, vomiting or diarrhea, loss of taste or smell, muscle aches, fever, chills, and eventually maybe even long-term chronic pain, hospitalization, or death are also possible. And these side effects may last many weeks, many months, or longer. We know many people now are have long COVID, meaning that they've had COVID symptoms for many weeks or many months, like brain fogginess and many other symptoms or conditions as a result. And so we always want to make sure that we are preventing the spread of COVID-19 if possible. These are a couple of numbers from the city. Lately, as of April 1st, we know that the number of vaccines here in the city are at 16 million doses. So 16 million doses have been given here in New York City. And we're on an upwards trend as of May 1st, right? So as of May 1st, COVID-19 infections have been increasing. We know that those who are in the hospital right now are mostly unvaccinated folks, right? So please get vaccinated if you can. Does COVID-19 protect against serious illness from the COVID-19 variants? We know that in mid-2021, Delta variant caused an increase in the amount of COVID-19 cases. Variants are going to be a thing of the future. They're just different versions, mutations of COVID-19 that have learned to sometimes escape the vaccine, sometimes have learned how to live a little bit longer. But we know that vaccines do help protect us against these variants. As I mentioned, most of the vaccines are around 50% effective at preventing serious illness from COVID-19. At the moment, Omicron is the most dominant variant. It has overtaken Delta. And we know that the transmission of Omicron is at higher than Delta. Okay, so very important to know. There are 2 subvariants of Omicron. It is spreading very rapidly at the moment, and breakthrough infections are possible even if you are vaccinated. But we know that all vaccines are highly effective in protecting against severe disease, hospitalization, and death. So what are the recommendations on wearing a mask? What should we do, right? So we know that persons who are 2 years of age and older and not fully vaccinated should wear masks indoors. That is the best thing that we can do, right? We know that in New York City, the current level of transmission is high. And so we should be wearing masks in indoor spaces at all times. We will be required to wear masks in hospitals and public transportation, right, here in New York City. we recommend that you wear masks anywhere where you don't know the vaccination status of someone you are around. Even when you're outside, right? You should consider wearing a mask in a crowded outdoor setting, especially if you're around people who are not vaccinated or people who are immunocompromised, right? So that means that their immune system is not 100%, that they should also be wearing a mask as well, unless they're told otherwise by their doctor or healthcare provider. So yes, so right now we are at level high. This is a little bit outdated, but we are at high. And so we recommend masks to be worn indoors at all times. And these are subject to change by the amount of transmission here in the city. So it may change. If it goes down, we are likely to see that recommendation change as well. But right now we are at level high and we recommend the mask be worn indoors. Let's talk about boosters. So currently we're recommending 3rd and 4th boosters, right? So 4th dose is recommended, or the 2nd booster is recommended for adults over the age of 50. And for those who are 12 and older and who are severely or moderately immunocompromised. So folks who have chronic conditions or diseases that may put themselves at risk of getting COVID-19. And we recommend that you get your booster about 4 or 5 months after your last dose. So highly, highly recommend that you get your booster if you have not gotten it yet and you're 50 and over. If you are not 50 and over, you should still get your third dose or your first booster if you haven't gotten it, okay? At the moment, we do think that we have seen that Pfizer's has just published some information about vaccinations under 5, for those under 5 being effective. And so we are hoping and hopefully expecting that later this year, there will be more information about vaccinating those who are 15 and younger, 5 and younger. Currently, there are trials for Moderna vaccine for those who are 6 months and older. What about those who are thinking about becoming pregnant, breastfeeding, or trying to become pregnant? We know that pregnant women are at high risk of serious complications if they contract COVID-19, including going to the intensive care units and having more difficult or negative pregnancy outcomes. And so it's really important. We recommend, the CDC recommends, and several maternal health organizations, ACOG, the American Academy of Obstetricians and Gynecologists, currently recommends that COVID-19 vaccines be given to people who are pregnant, breastfeeding, or trying to become pregnant. Right now, over 60,000 pregnant women are registered with the CDC to track how the vaccine is affecting them. No safety concerns have come out of this study. And it shows that being vaccinated can protect not only the pregnant lady or pregnant woman, but it can also protect their baby, right? And we know that COVID-19 vaccine does not cause infertility in women or men. Okay, so this is something very, very new, right? Which is COVID-19 treatment. We know that treatment is now possible and available, an available option to all who live in New York City. If you are sick, if you're feeling very ill and it's still, you have questions about whether or not you can take COVID-19 treatment, please call your doctor or call this hotline right here, which is a free hotline for the city, 212-268-4319. It's available to everyone 12 or older who test positive, and it is free. A doctor can prescribe the treatment, and it's usually a pill that you take for 5 days, right? Or a one-time injection if you're in the hospital, or an IV, right? It's put into your vein to help you fight the infection, okay? These treatments help you lessen your symptoms and keep you out of the hospital. Please call 311, call this number, talk to us if you need more information about treatment. We really highly recommend it. We also want to make sure that you are getting reliable information from Her Migrant Hub, right? So thank you for inviting us. So they're a trusted source in the community for information about COVID-19. The DOCO Department of Health, the CDC, the Center for Disease Control and Prevention, which is a federal agency, the National Institute of Health, or even our team can help, right? So any one of us can help answer more questions. This is our contact information. If you want to reach out to us, we're happy to answer any questions about health, about COVID-19, cancer screenings, health insurance. How do you make an appointment to get a vaccine? So you go to your local pharmacy. You can talk to the Department of Health at this number. You can call us. You can go to these websites. And you can also get in-home vaccinations. Okay, so before we leave you with a survey, I want to play a little video about a healthcare provider who's considering the COVID-19 vaccine. Give me 1 second.
My name is Sion. I'm an emergency doctor, a COVID survivor, and currently pregnant with my baby boy. I wanted to make an informed decision about the vaccine, so I consulted my doctor and researched what I needed to feel comfortable with my choice. Getting vaccinated would not only protect the little one in my belly, but my friends and patients as well. I encourage you to do the same.
So yes, she's a doctor who was pregnant and was also considering the COVID-19 for her and her little one. And so she really wanted to emphasize that she spoke to her doctor about getting a vaccine and to keep them both protected and safe. Now, this next video is from one of our staff members here at Memorial Sloan Kettering. She is a nurse practitioner, and she also wanted to share some words with you all.
My name is Kenny Lacussiere, and I'm an adult nurse practitioner. I've been at Sloan now going on 12 years, and I see and know firsthand how sick COVID can make a person. I was hit by it personally when my father, he was admitted here. He was very, very sick, came close to dying. And I also lost both my mother-in-law and my father-in-law to COVID. I personally was vaccinated 6 weeks ago. My arm was just sore for a couple of days. I felt a little fatigue, but all the symptoms went away within a couple of days, both with the first and the second dose. I got married on September 27th, and after coming so close to losing my father, to have him recover and to be able to walk me down the aisle, there's like really no words to describe how happy I was to have him be there and witness that day. I don't want any family to have to suffer what my family and I suffered, to have to endure what we did, especially now that we have a vaccine. I know there's a lot of, misconception about the vaccine. It is the only way that we can really curb this pandemic and put an end so we can resume our regular life. It will help prevent a lot of the heartache and a lot of the unnecessary illness and unnecessary complications from COVID.
So I know there are many powerful stories among us. I know it's not unique to one person anymore. Many of us have gone through these tough stories, but it's worth highlighting how, how this was just in recent memory, right? Many of us just went through this, and just want to highlight how important it still is to get vaccinated. This next video is of a school nurse, and she wants to encourage everyone to get vaccinated, including young people.
Hi, I'm Dr. Carolyn Volel, and I'm one of the many doctors caring for the children in our city's public schools. As a doctor, parents often ask me questions about the COVID-19 vaccine. One common question I get is, will my child have any side effects to the vaccine? Children who receive the COVID-19 vaccine may experience some side effects, including redness and soreness on the arm, tiredness, aches, chills, or fever. Side effects usually last for 1 to 2 days. Serious side effects are very rare. I tell parents we all do our best to keep our children safe. And as a doctor, I strongly recommend the vaccine to protect even more children and their loved ones against COVID-19. The COVID-19 vaccine protects children from getting very sick and being hospitalized. Get your child vaccinated today. Thank you.
You're muted, Raúl.
Thank you so much. So I'll leave you here with some time to reflect on the videos. Any questions that you have, please put them in the chat. We're happy to answer them. I have a question here. And the question is, how many gift cards? So Michael will talk a little bit more about the study in a little bit, the survey. I believe it is one gift card per survey, but he will talk about that in a little bit. I also have another question that says, does the vaccine really cause paralysis? So paralysis being kind of a stopping, I'm guessing a neurological stop in movements of the body. There have been no reports that I have seen that show that the vaccine causes paralysis. What we have seen is that the vaccine is actually very, very safe to take. It is one of the, what we can say is one of the safest things you can do. I know that COVID-19 infection actually has many other consequences, including blood clots, difficulty breathing, right? Long-term changes to the body that we still don't know about. But no, the vaccines do not cause paralysis. I have also not seen I haven't seen it be reported for COVID-19 vaccine, but that is a very good question. So thank you for asking that. So I see another question in the chat about COVID-19 treatments. So COVID-19 treatment is given at the very beginning of an infection, of COVID-19 infection. And so it's usually given to someone who has some pre-existing conditions, who may have other health concerns, for whom COVID-19 might be very, very serious. And so it's usually given at the very beginning, which is when it's easier to treat. And so this is usually a 5, if you're at home, you can call the doctor, call the city or call 311, see if they might give it, they might send it to you, and then a pharmacy will mail it to your home. And it's usually pills that you take 5 days in a row. They're just pills that you take for 5 days, and once those 5 days are over, the treatment is over, right? So it is that kind of one-time treatment for that infection that you just had. For someone who is in the hospital because of COVID-19, they may be given it through a shot, again, one time, or it may be given through an IV. So it may be given through a tubing that's delivered to your veins. So it can, work a little bit quicker, a little bit faster. But these are all great questions. Thank you for that question. Would anybody like to share whether or not they've received treatment for COVID-19 and how that has helped, or how that has how that experience was. We're happy to share those experiences as well in the chat. I know that's maybe some of us have not heard about COVID-19 treatment. It's very, very important to know that it's out there and that it's free, right? So even if you don't have health insurance, there's still many options to get treatment, to get vaccines. So please continue doing so and spread the word.
I actually took it, forgive me for interrupting. I took it because I had COVID recently, and it helped a lot. It really did. And it was a 5-day course, like Raúl was saying, and it really made things better. My symptoms went away more quickly than usual. So it's great. Definitely recommend it.
Thank you for sharing, Michael. Were there any side effects? If you don't mind sharing, were there any side effects from treatment?
Nothing much. There was a little bit of like a change in taste, or like this unique taste on my tongue, but it wasn't anything too bad.
Okay.
Yeah.
Okay. I'm glad to hear that it helped.
Yeah.
I see another question in the chat. Well, I guess it's more of a comment. Yes, 2 doses of the Pfizer vaccine. That is excellent. And that side effects were very minimal, right? That's usually the normal, what we see in a majority of people is just a little bit of, exhaustion, fatigue. I know I just went to bed. I took the day and I slept on the opposite side that I got the vaccine and just slept it off. Many people recommend to not take any sort of Tylenol or pain medication after getting it because it can dull the effect on your body. And so we don't recommend taking pain medication to relieve it, only if you really have to. We do recommend that you get a booster. I received my booster in November. We do believe that we might see another spike once things get cold in the fall and in the winter, much like the flu virus. And so we want to make sure that by the time we do see an increase in COVID-19 again, that we are all safe and protected. So if you can get your COVID booster, I think that would really put you on a great path to being protected against future infection. So I can't recommend it enough. So if there aren't any more questions in the chat, we're happy to continue answering some more. I want to let Michael explain a little bit more about the survey that he's conducting. I believe it's online, the gift cards that can be distributed, and maybe you can do a little.
Thank you so much, Raúl.